Hello and welcome to Pisgah Health Today. My name is Angela Owen. It is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals who are committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Shiela Jarvis. Shiela is the nonprofit liaison for the Pisgah Health Foundation. She has a degree in commercial art and advertising design that she received from Southwestern Technical Institute. She is married to her wonderful husband, Gary. They have 2 daughters and 3 grandsons. When she's not working at Pisgah Health Foundation, she enjoys landscaping, baseball, photography, and spending time with her family. Welcome to our program, Shiela.
Thank you, Angela. It's a pleasure to be here. And it's a pleasure to actually have gone to a baseball game this weekend, so that was awesome.
We celebrate. I'm also a baseball fan. My son is a collegiate baseball player, so that little commonality there between the two.
Very nice.
Well, Shiela, tell us a little about your background and how you came to be a part of Pisgah Health Foundation.
Sure. Well, I am native to Western North Carolina. I have lived here all my life. So I came to Pisgah Health Foundation in 2019, September of this past year. I've spent the last 10 years at Mission Health in their philanthropy department, in the fundraising department. I started in 2009 as the campaign coordinator for the Cancer Center campaign. At that time, we had a capital campaign raising money for the construction of the new building. And I served as the campaign coordinator. And it was an awesome time at Mission. We raised $15 million. $5 million of that came from the North Carolina State Employees Credit Union. It was at that time it was their largest gift that they had ever made, and they made that in honor of their employees. So they had the opportunity with that gift to name the Cancer Center. Therefore, it became known as the SECU Cancer Center. That was my first exposure to working in the nonprofit world, which opened my eyes to an amazing group of people. I've never met so many people that are passionate about giving back. They gave of their time and their resources, and it was just it. And I have never left the nonprofit world since then. It's been an amazing experience and a whole world that I was not exposed to before. So after the campaign was over, I transitioned into the major gift department as a development associate, helping the major gift program. And then my last role at Mission was the facilitated care manager. And in that role, I cultivated relationships with our caregivers, our regional hospitals, and our donors. I served as a personal health resource advocate for our supporters of Mission. And I was also involved in the Grateful Patient Program, which was one of the most fulfilling things anybody can be involved in. We would receive notes of gratitude from our patients. And I'm talking gratitude for all the different workers, everyone from the doctors and the nurses to the food service people to the environmental services people. And it was my privilege to deliver those notices to the managers in those departments. They shared them in their huddles. It was a morale booster. And it was a really great feel-good opportunity. And I also at Mission served in special projects. We had some internal projects, some construction projects. So I had my hand in that as well. And I've stayed at Mission until HCA purchased Mission. And when that signature was signed on the line, our department closed.
Fantastic. Well, what an amazing opportunity and history that you bring to Pisgah Health Foundation from all of those great things you referenced there at Mission. So bridge it over. What is it that you do right now that you're in Pisgah Health Foundation? Tell us, what is it that you do? What's the nature of the wheelhouse, as Lex likes to say, that you have with the foundation?
Okay, well, I am the nonprofit liaison, and I also work on special projects here at Pisgah Health Foundation. As the nonprofit liaison, I'm focusing on Transylvania, Henderson, Haywood, and Madison counties, developing relationships with the nonprofits. So similar to what I did in facilitated care, but my focus is different. So I'm developing relationships with our nonprofits, learning about the work that they're doing, the impact that they're having in the community. And a good example of, we recently became notified of a federal government program called Project America Strong, where they're supplying face coverings for nonprofits. So as soon as we receive that notice from Dogwood Health Trust of this program, it is coordinated also by the United Way of Asheville and Buncombe County. We sent a notice out to all of our nonprofits and made them aware of the program, and now we are coordinating the distribution of those masks. So anytime we receive information that we think would be a benefit to our nonprofits, it is my role to make sure that that information gets out, and we help as much as we can in that area as well. I also work very closely with Kathy Wood. Kathy is our grant operations coordinator, and that is also a very inspiring role to be in, to be able to read the applications coming in, to learn about the nonprofits, the work that they're doing, and the people that they're trying to help in Western North Carolina. And one part of that, the grant application, which I've been very fascinated with, is the number of volunteers. So in this, since Pisgah has started, we have granted 75 grants, and to 75 nonprofits. We've granted more grants, but it's gone to 75 nonprofits. And in looking at the applications, those 75 nonprofits, when you add their volunteers together, it's over 25,000 volunteers working in Western North Carolina. And just imagine the impact that these volunteers are making and how much difference that they are making in the work of our nonprofits. And speaking of volunteers, I want to take just a second to thank our volunteer board of directors. We at Pisgah Health Foundation have an amazing board of directors. I've had the privilege to witness them in action. And earlier you stated that they are 7 caring individuals focused on improving the health, wellness, and lives of the residents in Western North Carolina. And that is so true. They are invested in the communities in our region and in the people who live there. And it's just been a real pleasure getting to know them and watching them work.
Mm-hmm. What great perspective that you're bringing into that. And I love that you've got that, the multi-county view and being able to work across the nonprofits inside of that. There's so many in that multi-county view. There's so many different opportunities that Pisgah Health Foundation is working on, many different initiatives.
Mm-hmm.
What is one or two of your favorite initiatives and why?
Oh, wow. I don't know that I can choose one initiative. Pisgah Health Foundation has been working tirelessly since the beginning, February 2019. The grant program, we've had 2 complete grant cycles. We've had the Good Neighbor Critical Need Fund, where we provide funding, emergency assistance to nonprofits. Most recently, we have the COVID-19 fund. And so far, we've helped 19 nonprofits during this difficult time. Again, looking at the numbers, out of those, I think I said 19, 18 nonprofits that we've helped. There are hundreds of employees and volunteers that through the funding that Pisgah Health has done, helping these nonprofits, we've also helped the people employed by the nonprofits. We've had listening sessions. Those have been fun, listening sessions and workshops across the area, getting to know the nonprofits through there. Also at Pisgah Health Foundation, we have a development department. Lisa Ford is over that department. We have the Women's Giving Circle in Transylvania. We have the Physicians Roundtable. Pisgah recently became the proud sponsor of the Blue Zones Project. So Brevard is now honored to have the designation as the 50th Blue Zone community in the world. Again, before coming to Pisgah Health Foundation, I was not familiar with Blue Zones. So if you're not familiar with it, I would encourage you to go to our website and check out the Blue Zones Project. It makes making healthy choices easier. I guess that's the simple description of it. So we've got so many projects and programs going on. I get excited about one and then another one comes along. I get excited about that. So it's really hard to choose just one project or program. We do have more coming. One in particular that I'm very excited about, but just stay tuned. Keep a watch on our website and our Facebook page, and you'll learn more about that one.
I love the suspense. And I also appreciate that, you really hit a broad brush, and to think Pisgah Health Foundation was founded last year and it's already impacting so many different lives, so many different volunteers, the nonprofits, et cetera. So I understand how you have a hard time picking and choosing among them all.
I have a favorite of the day.
Right. What's the favorite in the moment here along the way?
Well, in the moment's the one that's on the way, so I can't share what it is yet.
Well, we'll have to have you back on the program in the near future to talk about that this exciting initiative that's still a little bit of a secret, but some exciting
Sure.
things. Well, Sheila, thank you so much for the work that you're doing through the foundation and for taking time to be a part of the program here today on Pisgah Health Today.
Well, thank you. Thank you for the opportunity to share about Pisgah Health Foundation, the work that we're doing, and the staff is just amazing. The board is amazing, and it's a pleasure to be part of the organization. And it's just wonderful being able to witness firsthand the difference that we're making in the communities in Western North Carolina. So thank you.
So very well said. So very well said. We want to also thank Wildflower Media for their creative and technical support and all that they do to help put this program out. Sheila's already mentioned it. We'll say it one more time. Thank you to the Pisgah Health Foundation Board of Directors for the hard work that they do, for the rest of the Pisgah Health Foundation staff. And we also want to give a thank you to the Physicians Roundtable that she also referenced for the hard work that they continue to do to help keep our community healthy and strong. If you want to reach out to the Pisgah Health Foundation, let me encourage you to email at info@pisgahhealthfoundation.org. We look forward to seeing you in the future on one of our next programs. And until that time, everyone stay well. We'll see you soon.